released last week by the coalition, which highlights the public's understanding, attitudes, and behaviors related to health equity and the social determinants of health, what the public thinks should be prioritized within social determinants, as well as perceived impacts on family well-being. Before I turn it over to our speaker, I just want to make two quick announcements. One is that the coalition's National Summit, annual summit, will be held this year virtually, October 4th through 6th, and the RFP for the summit is going to be released to the public on Monday. If you are interested in presenting and lifting up how your organization is addressing the social determinants of health and health equity, we would love to have you submit. Look out for an email from us on Monday on that. And two, if you have any questions, please put them in the chat and we will get to them at the end with whatever time we have remaining. And with that, I'm very happy to turn the mic over to my colleague, Alexandra Lewin-Zwerdling, who's going to take us through the results of the research.
Thank you so much, Tom. And as Tom said, thank you everyone for joining today. Just by the numbers, I'm really glad there's a lot of interest in this consumer insights research. Very quickly, and then I'll dive into the results, just a few things. Tom already mentioned that the research was released last week. What I'm going to show today is a shortened version of the full report, but I did want to point you to the news section of our website, which has the full report in its entirety, the report in brief, which is a more narrative, shortened form, the press and the press release, and all of those are available for anybody to download. Should you need the data in another form like PowerPoint to use in presentations, which we would strongly encourage, please just send us a note and we're happy to send it your way. The main thing that we want to get out of this research is that people see it, that it's shared, and that it's used. So in as much as we can help you do that, please always feel free to reach out. Lastly, today's session will be recorded. So if you don't want to take copious notes or just want to refer back to it or share it around to your colleagues, it'll be posted on the Root Cause website following my presentation today. And then lastly, as Tom mentioned, feel free throughout the presentation to put any questions that you have in the chat box, but there should be ample time at the end to address any questions that you have. So with that, Hannah is going to be advancing the slides today, so you'll hear me say next slide, but I will dive right in. Great. Okay. Let's go back to the top. Thank you. Okay, next slide, Hannah. Perfect. Okay. So some of you who have been more involved with Root Cause may have heard me talk about the methodology already, but in case you haven't, I just wanted to orient everybody to how we approach this research. So as Tom mentioned, we were really interested in seeing what do consumers know, what does the public know about social determinants of health, what's their awareness, understanding, knowledge, behaviors, et cetera, when it comes to social determinants, the pieces underneath it, and all of the terms that kind of surround it when we talk about social determinants of health. So to meet those objectives, we did an online survey. There were 1,200 participants, and in order to pull out findings from two subgroups, we oversampled for Hispanics and we oversampled for African Americans. So you'll see throughout the survey that I call out those populations along with other demographics throughout. The survey was about 7 minutes long. You had to be 18 and older, and you had to reside in the US, and it was fielded lastly in mid-October. Next slide. Okay, so I want everybody to look very closely at this slide because I think it's one of the key findings. I can't say that it's wildly surprising, but I think the implications are deep for us who work in health equity. Mostly that when you look at what terms are familiar around the idea of health justice and health equity, it is not at all surprising that a term that had national recognition like Black Lives Matter is the most familiar term in this long list. When you look to the bottom, you see social determinants of health. If you look at the dark green, which signals familiar and know what this is, only 1 in 5 consumers or the public reports being familiar and knowing what this term is. So as we who work in this field think about how to communicate in a way that resonates with the public, I think it's incumbent upon us to think about where we can provide education, but also where we can meet the public where they are in terms of talking about health equity and health justice in a way that we know resonates or motivates or provides understanding and awareness to consumers. Next slide. Great. So here's a theme that you'll see throughout, which is what we did is we broke down a lot of these findings by race, and I don't show it for all, but we do have them available for all of our questions. And one of the themes that we see pulled out is that whites or Caucasians have, in general, a lower familiarity with these terms and with health equity and health justice in general. So you can see here that dark green is the Caucasian line, the light green is Hispanics, and the middle is African Americans. And as you scroll down these list of terms, you can see that in general, whites are less familiar with these terms. Next slide. Okay, so this is exactly the same question, but this one is broken down by age, and I think it's pretty interesting. So as you get older, or as consumers get older, those ages 55 plus are least familiar with social determinants of health, but they tend to be more familiar with some of these other terms, whether it's chronic health conditions or well-being or systemic racism. Some of them apply more directly or tend to apply more directly to older adults, but you can see that there is this significant drop-off. 60% of those who are under 5 say they're familiar with social determinants of health, whereas only 40% of those who are 55 and older do. Next slide. Great, and then here, same question, but broken down by income. And you can see here, social determinants of health awareness or familiarity is highest among the higher income segment and lowest among the lowest income segment. So again, when we talk about these terms and who we're targeting and who we're trying to close that health equity gap for, this is an important component. Next slide. Great, okay. So we just saw that in general, there's low level of familiarity with terms like social determinants of health, but also terms which I didn't really talk about, like health equity. Yet when you ask it more specifically, you can see that the majority of people, majority of consumers, believe that the conditions in which you're born, live, work, play, worship, and age have an impact on your quality of life. So when you start explaining it a little bit more, people say, you know what, yeah, I do know what this is. And I really do think that it has an impact on maybe not my quality of life, but people in general and their quality of life. Next slide. Great. So this, again, is broken down by race, by age, and by income. And it's the same question that I just showed, but I wanted to call out that this theme that we're seeing holds, where we see Hispanics and African Americans to a lesser extent here, but Hispanics significantly more, making this connection significantly more than Caucasians, 72% compared to 66%. Again, as people get older, they're making this connection more so, and then higher income individuals as well. Next slide. Okay. So we saw low levels of familiarity, but we did see in the past couple of slides, consumers making the connection between where you're raised essentially and all of these environmental factors and ultimately somebody's health. We also see in this question that a majority of respondents, nearly 60%, believe that there is some sense of responsibility for the greater community's health. So it goes beyond personal responsibility in a sense. And when I was talking about these slides yesterday, I did bring up that sometimes these online surveys, you want to caveat some of these findings because they can have some bias in them, in as much as participants in these surveys sometimes report back what people think they should say. And so when we think about future research or areas to drill down, this one would be a really interesting one to not just say, yeah, I think that we are responsible, but what are you doing to show that there is this greater sense of commitment to community? Next slide. Okay. So thinking about the last slide and responsibility to the greater community, this one breaks it down again by race, age, and type of area where you live. So you can see again these same themes: Hispanics and Latin American and African Americans higher than Caucasians, younger individuals, and then those in rural areas, which I think is actually a little bit different than some of the findings you'll see as I go through this deck, but you'll see here large cities were the least likely to say that we have this sense for greater community compared to rural areas. It's not by a huge margin, but there is a little bit of a difference there. Next slide. And then as we look, this kind of flip-flops. So here we go, we see belief that conditions where we're born, live, learn, work, and play, et cetera, have an impact on your health. And we see large cities believing more wholeheartedly that there is this connection. Next slide. Okay, so now I'm going to move into a different section, less about awareness and more around attitude and behavior. Next slide. So up until this point in the survey, we had not provided participants with any sort of definition around social determinants of health other than that long statement that I had previously read. So this is the first time in the survey where we show any definition around what do social determinants mean. And as you can see here, we provide this general definition, but then we also provide these 5 categories: economic stability, education, social and community context, health, and neighborhood and environment. And we do provide that parenthetical explanation underneath each one. Next slide. So when we follow up after we provide the definition, people starts to resonate with people a little bit more. So here we see almost 60% rate a 4 or 5 on a 1 to 5 scale, with 5 believing wholeheartedly that it's important to address social determinants of health. So you get a majority of the public saying that, yeah, you know, once I kind of understand what social determinants are, or I'm familiar with the terms underneath it at least, this is something that's important to address. Next slide. And then here again, we break it out by these subgroups that I've been talking about. So you can see here, when you ask this question and you break it down by race, you can see African Americans are significantly more likely to say that social determinants should be addressed compared to whites. Age is a little bit less of a difference across age groups. Same with income, and then you get this theme recurring in large cities where you have 67% compared to say 51% in rural areas that say social determinants of health should be addressed. Next slide. This is a slide that I think is worth pointing out, because whenever you seek to move somebody, whether it's on Capitol Hill or whether it's a friend or family member, or whether it's somebody that you're serving through the work that you do, you want to understand what motivates them or why they think about a certain issue the way that they do. And here we follow up for those who say social determinants of health are not important to address, or doesn't directly, that they're not important to address. We see 27%, so over a quarter of consumers saying that the reason why they're not important is because the issue doesn't directly impact them. So think back to the level of familiarity with social determinants of health. If you think broadly and you say something like, does social determinants of health impact you? You may get a higher percentage of consumers saying that, no, this issue doesn't directly impact me. But I'm now going to show you a number of slides where we see that once you start drilling down on the individual components within social determinants of health, it does in fact start to impact the public. Next slide. Okay, so this I'm just going to gloss over, but I did want to point everybody who's on this webinar today to these sets of slides where we break it down in a lot more specificity around race, age, income, and area of residence. And you can see here, when you look at why social determinants of health are important, you can see that the majority of respondents say it's because they believe we're all in this together. And that really cuts across race, age, income, and whether or not you live in a large city or a rural area. Next slide. Okay. So I mentioned before that there were these components underneath social determinants of health, and the definition that we gave survey participants had economic stability as one of the components, health and healthcare, education, neighborhood environment, and social and community context. So we asked survey takers, rank the 5 categories of social determinants of health in order of their importance. And so we see here economic stability was ranked number 1 by a majority of survey takers. So as we thought about this, we got these results back and we said, we thought that's really interesting, economic stability and health and healthcare. But when you think about economic stability, what is it, right? It's poverty. It's having the financial security to meet basic needs. And so as we think about our work as the Root Cause Coalition, is poverty really like the root of these social determinants? And how do we continue to really focus on the work that can close that economic insecurity gap? And then, like I said before, health and healthcare was just behind economic stability. Next slide. Okay, so this is also interesting, and I think it probably warrants some future research around understanding of these subpopulations. But we asked a question around who do you think is most at risk from social determinants of health? And you see here, which may not be surprising given the last slide that I just showed, people with low income. So again, this poverty piece showing up. Second to that is older adults. And right behind that, people with chronic health conditions. As a quick reminder, this survey was fielded in October, right? In the midst of our pandemic. So layered on top of survey takers' general perceptions is the idea that we're living through this pandemic. And I think a magnification of those populations that are most at risk from these types of issues. So of course, people with lower incomes, but also older adults, which we've seen clearly be in the higher risk category with COVID. Next slide. And then I just wanted to highlight quickly here, because we do see this as another theme that recurs throughout the report. We ask a question: how much has each of the following been negatively impacted by social determinants of health, or SDOH? And by and large, people feel like, quote unquote, society as a whole has been impacted to a greater extent than myself or my immediate family or even my close friends. I think this is an interesting finding because I think you can read it in one of 2 ways. Either there's this sentiment that society as a whole is kind of worse off than I'm doing in terms of the impact of SDOH. Or the flip side of that is I haven't really changed my behavior that much to take responsibility for the greater community. And so as a result, I haven't been as impacted as the people around me. So again, I think something worth drilling down, but you can take a couple of meanings from these results. Next slide. Okay, and then here again is just a drill down of these 5 components of social determinants of health and how each group has been impacted by them. And again, we see economic stability kind of rising to the top in terms of impact when you look at the various components of SDOH. Interestingly, social and community context, which was ranked fairly low in terms of importance, actually has a pretty widespread reported impact across the board. So you yourself personally, your close circle of friends, and society as a whole. So it's an interesting distinction here where people feel like your social and community context has impacted individuals greatly, but it may not rise to the top in terms of level of importance in addressing. And I think that's something, again, worth exploring further. Next slide. And then I'm not going to spend too much time on this one, but it's how have you personally been impacted by social determinants of health? And again, we see the same theme where economic stability rises to the top pretty much across the board, regardless of race, age, income, or geographic region. Next slide. Okay, so now we're going to move a little bit more into our social impact section, so we can head right into the next slide. Okay, so when we think about the last section that I showed, I talked a little bit about ranking and importance of social determinants of health, which ones have the greatest impact on health. Then we asked a question on what are the items in this list that could improve your health the most. So a little bit different from impact. And I think as we talk about social determinants of health, it's important to draw that distinction between what's most impactful in a negative way, right? And then what could improve your family's health, which is different. And so here we get 3 things, which I think, again, underscores the work of the Root Cause Coalition and continues to make the case to focus in on the areas where we've been focused in on, and also as a reminder of some of these other areas. So top items that can improve a family's health the most: healthcare services, good quality food, and affordable housing. So if you think about what Root Cause has been working on, food security, housing insecurity, access to healthcare as a cross-sector approach, it makes me happy to think that kind of we're in the right arena in terms of our focus areas. If you look down a little bit more, you see job opportunities, things like clean water and air, medicines and medical devices, which may or may not be able to be rolled up into healthcare, and then good schools, again, with the layer of COVID kind of on top of this whole piece. Next slide. Okay, so now I'm going to move into responsibility. So we talked about social determinants of health, but who and the impact that they have. But we wanted to also find out what's the consumer sentiment around who should be responsible for addressing these issues that may or may not be top of mind for individuals on a daily basis. So top 3 entities. So again, just to orient you, that dark green was when a survey participant ranked it as the most important or the most responsible in this case. Lighter green, it was ranked number 2, and then yellow was ranked number 3. So you see here, government, right? Federal government agencies, followed by local, state, and federal policymakers, followed by public health departments, and then community-based organizations. Followed by me and my family, pretty much neck and neck with community organizations. So there is this sense of personal responsibility, but there is an almost overwhelming sense of government responsibility and a broader responsibility beyond what one would take as personal responsibility. And then if you look at the bottom, you get some other sectors like food companies or banks or grocery stores, who consumers believe should be most responsible for addressing these disparities. Next slide. And again, I'm not going to go through this in detail, only to highlight that you can see it's in pretty small numbers on this slide, but the blue are what was ranked the highest within each of these columns when it comes to some of these government agencies. So Hispanics called out local, state, and federal policymakers. Older adults, again, same local, state, and federal policymakers. Those who are making less than 50,000, as well as that middle income group, both federal government agencies and local policymakers, And so you can go through this chart in more detail, but I really just wanted to let you know that these types of tables are available for each of the questions that we asked. Next slide. Okay, so we took a little bit of a different slant on this question, and we wanted to look at not only responsibility, but when it comes to personal responsibility, how likely are you to buy from a business that's making an effort to impact social determinants of health in your community? And part of this was because we've seen lots of these movements over the past year, whether it's Black Lives Matter or something else, that I think is worth exploring over the next several years, right? This is not just a one-time question that I think should be asked, but more of something that's, how do people change their behavior? How do they spend their money when it comes to the connection between social determinants of health and health equity? And so you can see here, about half of consumers said that they are likely to buy from businesses that are making an effort to address SDOH. You get about 40% that kind of are in the middle of the road, but only 9% in that more no or negative category that say that they aren't really likely to buy from businesses. Again, this is one of those questions where you caveat it with our participants telling me what they think they should tell us. But it will be interesting to explore it over time to see how, especially with the new administration and a focus on health equity, how some of these issues, which may get raised even more so in their visibility, translate into how we spend our dollars. Next slide. And then this is just a drill down of the last question. And you can see here, Hispanics and African Americans are more likely to buy from these businesses than whites. The age, there isn't that much significant difference across the age groups. There's a little bit of distinction between lower income and higher income, and that may just be because of expendable income. And then a very stark difference with those who live in large cities. 62% say they would, compared to, say, other areas, rural areas, 50%. Next slide. And then we had just a couple of questions, knowing that this whole survey was layered with the impact of the pandemic. We did ask a couple of questions that were specific to COVID-19. And here I just want to underscore again, you see this society as a whole piece come back. And so this question was, how much has COVID negatively impacted the health functioning and quality of life of each of these groups? And again, you can see that society as a whole is perceived to be more negatively impacted by themselves personally, their immediate family, or themselves. And so, again, interesting. And there's kind of two ways to read this. Either people's behaviors haven't changed as much as other people have changed their behavior, or people haven't felt as impacted as the perceived impact on society as a whole, or a little bit of both. Next slide. Okay, so that's the meat of it. We did have a few open-ended questions in the survey where we allowed people to write in their responses. And so I just wanted to point you to that section. And if you are in need of various quotes related to social determinants, we have some good ones pulled out. But this was just some general feedback on the survey itself and their perspective or position. And again, this is just a snapshot. The survey was 1,200 people, but we tried to pull out the ones that we thought were most interesting. Next slide. Okay, and then I'm not going to go through the demographics, but again, so you know it's there. Hannah, you can just scroll quickly to the end. All of the demographics in the entire survey are in the full report. They're not in the report in brief, but if you have specific questions about particular age groups, income, etc., by all means, let us know. Perfect. Great. So I'm going to stop there, and we can use the rest of our time for any questions, thoughts, feedback, future research ideas. We'd love to hear from you. Feel free to add them into the chat or unmute yourself.
Well, it's a lot of information to digest, and while maybe people are mulling it over, I'll just, I won't ask a question, but I'll just sort of make a quick observation and then turn it back over to you. You've been doing a lot of talking. Oh, nope, here we go. Here's one. Let's start out. How does TRCC intend to use this information? What is the goal? How will the process of this goal be evaluated? Will there be a report in the future to demonstrate progress?
Great questions. So not knowing how familiar you are with root cause, and Tom, obviously chime in here, but there are kind of three pillars of root cause: education, advocacy, and research. And one thing that when we designed this survey, we wanted to be really cognizant of is that this research was not being done in a vacuum. And so I think our first question was, why are we doing this research in the first place? And Tom shared a little bit about that at the beginning. But there are a few reasons, right? One is to figure out how to talk about social determinants of health, whether we're working in a food bank, right, and serving individuals, or whether we're trying to push particular legislation on Capitol Hill. And so knowing kind of the pulse of the consumer is really, really helpful in terms of the communications piece. But I'll also say that when you think about these pillars and you think about the advocacy pillar in particular, these findings inform greatly the type of policies that are needed, but also give fodder or really like crisp data to take to the Hill to say, you know, hey, Congressman X, people are really, really impacted by this. And when we talk about it on a national stage, this is the language that resonates. And so it's kind of twofold. There's this education piece, but then there's this advocacy component. And so we do plan to do more research over the coming year. We plan to identify gaps that we can draw out of this research. We've got other research that's forthcoming, which is in more narrative form, which essentially describes the work of many of our members during this pandemic. But those are just a couple of ways that we will plan to use this research.
Great. All right, next question. The insights section indicated that 73% of those with incomes of 100,000 or more believe that the conditions in which people are born, live, work, play, worship, and age have an impact on a person's health, functioning, and quality of life. Was this surprising, since high-income people are typically the ones that benefit from this, and people do not usually recognize the inequity of these systems that they benefit from?
Yeah, it's an interesting question. I mean, I think, you know, income and education tend to go together, right? And so intellectually, someone can know that there are these systemic issues that impact society as a whole. They may not feel them as directly or as acutely, but as you think about income and education kind of going hand in hand, and just from a pure intellectual standpoint, it's not terribly surprising that people are making this connection. I think impact is a different story.
Great. Next question. Based on the attitudes section and the reasons listed for why SDOH are not important, does TRCC have a plan for increasing awareness about how the social determinants of health impact people?
Yeah, I'm talking a lot, so Tom, chime in. But like I said, we have these pillars of education, advocacy, and research. And so education is a big component of what we do, whether it's sharing information from our members or to our members, and I've talked about this a lot, but identifying how to communicate about SDOH in a way that people do feel like they're important, right? So if we talk about poverty, or if we talk about economic security, that may be a more motivational component within SDOH to use, where people feel like, you know what, poverty is a real issue and it's something I can identify with. But if I just talked about social determinants of health, that's pretty wonky, and the vast majority of the public have really no idea what you're talking about.
Yeah. I'll follow up on that and just say yes, and that the stated goals for root cause for 2021, what we're calling our four corners, are ensuring payment for non-clinical services for community-based organizations in Medicare and Medicaid payment models, cultural competency in the healthcare workforce, target for national healthcare expenditures, as well as specific plans around addressing specific determinants of health born from systemic, or addressing health disparities born from systemic racism. And we're calling out also infant and maternal mortality, as well as mental health. And there's a lot in all of those that we're going to be doing. And we're happy to kind of delve into that more offline. Let me go to the next question. Will you form a collaborative cross-section of professionals that will develop more strategic plan across state boundaries for consistency? Let me just take that one and say, yeah, that's going to be tied in again with, I think, the four corners for 2021 for the Root Cause Coalition. We're going to be, we've got committees and roundtables specifically set up around those priorities coming, and there'll be more on that we're going to be releasing in the future. Next question. Remembering that our families do not live in just one area of the country.
Yeah. I think that's a follow-up comment.
Oh, okay, sorry. On a program level, how important is it that our food bank clients understand what the term SDOH means to them? What are the most important, good question, what are the most important action steps a food bank can take to educate our clients?
Yeah, that's a great question. I think you guys probably know better than we do in terms of how to answer that, but I will say from a kind of academic-y lens, SDOH, I mean, it's, I don't think that's the term that needs to be used within a food bank setting, right? It's clear here what is most impactful. And you saw right behind health and healthcare, you saw good nourishing food. And so clearly within SDOH, there's the desire to close that gap. And so I think it's really, how do you reach your clients, right? How do you make yourselves feel accessible? And I don't know that using SDOH as the framework for health equity or food security is necessarily the right one if it's not coupled with a lot of education. And even then, is it the right term? And I think that's kind of out of my scope, but it's worth exploring, at least from this research.
Great. Okay, next question. Thank you for this work. I recently read your status of health equity provider report. Oh, thank you. And this consumer research, will you be aligning the findings of each? I think that could be powerful.
Yes, Megan, great question. They're very complementary in the sense that one looks at providers and one looks at public perceptions, and it's worth going through and thinking where they align and don't align, particularly since health and healthcare was really at the top of the list in terms of impact and areas that need to be addressed when it comes to social determinants. So they looked at two different populations, as you know, and they are complementary. And the answer to the question is yes. Moving forward, we do plan to take those in tandem for various purposes.
All right. Well, that seems to be our last question. Wait a minute, I see a few coming in here.
I think that might be from our staff. Thank you for your response I'll just read the last one, Tom.
Okay.
Thank you for your response at our food bank to promote social determinants. We're focusing on food as medicine with our new mobile food truck to provide both employment assistance and financial coaching on site distribution sites. Yay, that's great. I think as much as you can provide those wraparound services, obviously, one of the takeaways that I didn't really discuss at length here, but is that social determinants means a lot of things to a lot of people. It's not just economic security. It's not just nutritious food. Even though I showed kind of this rank 1, 2, 3, none of those are in isolation. So the idea that you guys can address multiple layers is terrific.
All right, well, we seem to reach the end of our questions. Alex, let me just ask you to do one more round through maybe just sort of a general takeaway, just a final wrap up, just to kind of hit the high points, and then we'll close it out.
Yeah, I'll just say again, stay tuned for additional research from Root Cause. We welcome your feedback. We plan to use the takeaways from this research in our advocacy work, in our education work. We don't want to have our research bucket be siloed from the other work that our members are doing. And so it's very, very much applied research, but it is informative from a communications perspective, and also just to have a rich data set that we can pull from. And obviously the devil is in the demographics, right? When you pull out rural or urban or Caucasian or African-American, the general findings don't tell the story as much as the data that's underneath it. So I would encourage everybody when you go through it to not skip over some of those more nuanced findings. So thank you again, everybody. We really appreciate you being on. And Tom, I don't know if you have anything else to share, but.
Just to follow up for next steps, the easiest way to keep track of all of our events and follow up research is to go to our website, and in the news section, you can sign up for our newsletter. We're constantly lifting up the work the innovation and the work that our members are doing, as well as media monitoring of all social determinants and health equity news items that are coming out. Yeah, and with that, I guess we will call it a webinar. Thanks again to everyone. Thanks again to Alex for taking us through this deep dive. It was a lot to digest. Any follow-up questions for Alex or I, you can just reach us directly, tdorney@therootcausecoalition.org, and we'll be sure to follow up. And of course, we can also get that research out to you as well. So thank you, everyone. Stay safe. Have a great weekend, and we will ping you for the next one.